Hi YouTube subscribers, hi YouTube world. I just want to give you guys another update about what's been going on in my life. I know I haven't been uploading as much regular content, but I at least want to keep you guys up to date for my loyal subscribers and anybody who's new, who's interested. So, I just got done doing another work week and it went well. I mean, all things considering, I think it went well. I feel like even though I haven't been a nurse that long, because I'm in a higher acuity setting and I'm doing a lot on my own. You know, I've been on my own now for at least a few weeks. So I feel like in a ways that has been getting me a lot more comfortable with being a nurse in general. I'm practicing a lot of skills hands-on, really starting to get some of those skills down. Things that seemed really hard or confusing are not as daunting to me now. Some things have just become so routine that I don't have to think so much about them before I do them, which is really nice. It's less draining. Like, I feel like the more I go on, the more things just kind of start to become muscle memory and automatic. I am still having some difficulties where I work as far as the patient load. Again, I've said this before, I feel like it's way too much. Especially this weekend, I got a lot of admits along with my regular patient load, which really kind of screws up the routine. Not just the routine, but most importantly, my biggest issue with the admits is the amount of time it takes away from the time that I could be doing patient care. Instead, I'm doing these admits, which means I then wind up staying later, and I don't like that. I was supposed to start my volunteering. I think I mentioned last week in my other video that I wanted to start volunteering at a ranch, at a horse ranch. Well, I actually missed that opportunity. I was supposed to be training Saturday when I got done my shift, and because of all the admits and stuff that needed to be done, I didn't get out of work on time, so I missed my training. Now I called them and let them know, as I knew I was going to have to stay at work later than what I was supposed to. I called them, let them know that that I wasn't going to be able to make it, and I mean, luckily that place is willing to work with me, but we'll see what happens, because their next training is again on a Saturday when I'm working. So if I have to stay late, then I might miss the training again. And it's not for like almost another month. So in the meantime, I was actually going to look into possibly volunteering at a different ranch that has training time that would work better with my schedule, and it's actually closer anyways, and they seem a little bit more flexible. So I might just not even volunteer at the first one that I took interest in, since it doesn't seem to be working out, unfortunately. So that's what's probably my biggest problem with my job right now, is not being able to get out of work on time because it's interfering with my personal life, as far as I'm too tired to do anything, which, I mean, that would happen regardless where I work at, but I feel like I'm too tired when I'm driving home, which I don't like. I don't feel like that's safe. I was talking to somebody I work with, and they said that actually a couple nurses wound up passing away at the last place they worked at because driving home, they started falling asleep at the wheel and had car accidents. So that's what I don't like. And I don't like, too, that it's interfering with other stuff I have scheduled. And my job just told me the other day they're changing my schedule now because somebody left, and I don't get a say in my new schedule either, which I don't really like. And also they're switching me to the weekends now. And I do work, right now I work Wednesday, Thursday, Friday, and then every other week they make me work Thursday, Friday, Saturday, but now they're wanting to switch me to Saturday, I think Friday, Saturday, Sundays, They haven't told me, but they said they want me to work at least Saturday, Sunday every other week. And I'm thinking they're going to make it Friday, Saturday, Sunday, because that's almost what I'm working now instead of Saturday, Sunday, Monday. But I still don't know yet. I'm still finding out the details. I tried to get that information from them today, and the person who does scheduling wasn't there, so I don't know. But that new schedule is supposed to start in like a week, and I don't get, like at a hospital you would get shift differential. You would often get into a weekend program as a nurse if you're working the weekends where you get paid more, and they don't do that at my job. You don't get paid more for working nights, which I do, and you don't get paid more for working weekends, which kind of stinks. I don't think most people want to work weekends. I know I don't, because that's usually when I make plans with friends, and it's also, it's kind of harder to get things done at that place on the weekends. Like, I have to call out for labs. Labs don't just come in to draw blood work, for example. It's just like more things you have to do on the weekend and less resources available, I feel like. So I'm not too happy about that, but like I said, it's out of my control. It is what it is. And I'm really happy, don't get me wrong, I'm really happy just to have a job, and a job in the medical field as a nurse. I'm very fortunate that they took me on as a new grad with not any medical background. So I'm gaining so much skills, so much experience. I'm in a more higher acuity area than what I originally wanted, but I feel like it's actually been really good for me because, number one, I'm more comfortable now in working in a higher acuity level unit like progressive care, possibly even ICU I would consider now. You know, maybe even the emergency room. I'm just feeling a lot more comfortable as a nurse. I feel confident around patients now. Like, that really scared me, I think, at first, was, dealing with patients' families and dealing with patients themselves, like what to talk about. Just like weird, silly things that you worry about as a new nurse, and then you realize, like, oh, it's not really that bad. And you just start getting more comfortable the more you do it. And I am starting to develop a routine there, which is nice. Like, one nice thing about long-term care, I think, in general, compared to a hospital, is you really do start to get familiar with your patients, and you get to know what they like, what they don't like, what their medical problems are, what their history is. You start getting comfortable with their families, and you kind of know what to expect from them, and you know what's abnormal from them. That's the nicest part, I think, about working long-term care, is you already often know a lot of your patients. You know what to expect, and you know when they're acting funny, when something's going on with them that could indicate an issue. Is really nice. Yeah, so just in general, I feel like if you're a new nurse, just keep going, keep putting in effort, keep trying to soak up as much as you can, because it starts to get easier and easier. I think the more you're at it, I'm starting to like it. Like, at first, I was like, oh, this is so scary. This is all so new. I don't know what I'm doing. I feel like an idiot. But then the more and more you work, the more you start getting more comfortable, more confident. It's not, you still always are thinking and critically thinking as a nurse, but some stuff you don't have to worry or think about as much. It all starts to get into a nice flow and get easier the more you do it. And you start realizing a lot of nursing, especially the skills, are kind of like common sense. Like, yes, we have to critically think, as far as we have to think ahead, we have to do time management, we have to know how to work around other people who have different personalities, and we have to think constantly, why you're doing something, the reason behind it. It's a job where you have to think a lot. But on the same token, it becomes easier as far as, like, skill-wise and a lot of stuff starts to become more like muscle memory and common sense. Like, look at your patient first. You don't have to start thinking of all these intricate things that you might have had to when you were in nursing school, because you already know a lot, and not everything is as complicated as it was at nursing school. Like, yes, we have to learn complex disease processes and pharmaceuticals and all of that, but then once you start working, you start coming up against the same like medicines, and you don't even have to look them up. After a while, you're like, oh, I know what this drug does, what it's for. You know what alarms are what, after working at a place for so long. Like, I know what a lot of different vents sound like versus a bed alarm or a tube feeding alarm. Like, everything starts to make more sense, and you start knowing what different sounds are and not having to figure stuff out as much, I guess, as when you first start, which is nice. Yeah, so my advice is don't give up. There's a lot of times where you're like, I don't know if I can do this in the beginning. It's also overwhelming. But like I said, things get better. Yes, I still have some issues at my job, which I already just discussed. But, in general, I would say I'm feeling a lot better. I'm getting more situated, more confident, not as drained, and starting to like the job more. It's starting to become more easy, I guess. And yeah, so this weekend I got to do my first successful IV. Yes, I've tried to start IVs at this job before, but every other time it was either somebody else got to it first, or I couldn't get it, because a lot of the patients at my job are very hard sticks. They're elderly. Their veins are very fragile, very thin. Sometimes you can't even see their veins. They have poor blood circulation and swelling and other issues going on. So a lot of times we have to call in an IV team that just does PICC lines and midlines, that specializes in that. And I think they do like Doppler. They use a Doppler to see the veins. So I was very proud of myself, because I did get one of those patients who was a hard stick. I actually was able to stick them and do an IV successfully. What I did was, I knew they were a hard stick. I talked to their family. They told me they were hard stick. I talked to other nurses, and you could just tell, like, you couldn't really see like hardly any veins on them. They were swollen, and that's what I kind of use, is the visual of feeling and seeing the vein. Well, I couldn't feel or see hardly any veins. So what I did was I called in the IV team that does central lines, because they needed one anyway for the type of IV drug they were getting. But initially, to start with, they could have a peripheral, and I needed to get their medication in them. So I attempted to do the peripheral, and on the first attempt I was actually successful. So my tip for you, if your patient is a hard stick, they're a hard stick, and you need to get them on IV fluids or antibiotics right away, is if they get labs drawn regularly, try to use the same vein that the lab uses. Because if the lab is able to draw blood from them, they have to have a good vein somewhere. So I looked at where I seen the person drawing blood. I knew they were drawing it from their hand area, so I, cleaned it off really good with alcohol. That's another tip, is if you can't see their veins, get a lot of alcohol swabs. And most IV kits come with the ChloraPrep anyway, because you gotta disinfect the area to begin with. So use that, rub it hard on their skin, and that usually helps bring up their veins. Now if you don't know where they've been stuck before, and the alcohol is not bringing up their veins, or the ChloraPrep, the other tip that I've heard before from other nurses is get a warm, moist cloth and put it over their arm or their hand for like 15 minutes, and that will help bring like their veins to the surface so you can see where the vein is, because you have to be able to see the vein usually, and you also need to see where the vein is going to get a successful IV, because you want to be sticking your needle not only where the vein is, but you also want to be pushing it along the skin in the direction that the vein is going. That way you just don't poke through the vein, because you want it to run basically parallel with the vein. So you want your needle to be following where the vein is going, for like forward in their arm, if that makes sense. So what I did was I held my needle, you know, at 15-30 degrees to pierce the skin, and then I once it's in, then you want to pull your needle down or your catheter down, depending on what needle you're using, so that it's almost flat against their skin. That way you're not piercing through the vein, and you want it to travel along with where their vein is headed up their arm. So that's what I did. I was able to get their vein, get their medications in right away. Yeah, and then also I did my first central line dressing change, which is another very important skill, and it's kind of like, I don't know, it's kind of something you get proud of when you do for the first time. So I did that. I had watched somebody do it before, and I'd watched videos, and I was able to do that. The main important thing when you're doing a central line dressing is make sure that they're, I don't know what you call it, but the little like cap that's on their line, make sure that that is closed, because if not, when you take out their hub, air can go through and actually give them an air embolism. So that and sterility, of course, are the two main things when you're doing a central line dressing. So I did that successfully, and I also did my first IV push medication. I work with pretty much at that facility, it's all LPNs. I'm one of the very few RNs that work there. And when I work at night, I'm like the only RN. So I had to do the IV push medications, because LPNs are not, you know, unless, well, in Arizona at least, they're not allowed to do it. So I did that, and I hadn't even seen that done there, but I know how to do it from nursing school because we practiced it so many times, and we had checkoffs on it and everything. So I was like, you know, remembering back, like, how do I do this again? So I remembered how I did it, you know, thought everything through, the steps all through before I went in the room, and, looked up their medication, all the steps you have to go through, and then I went in and did it, and I did it just fine, and it all, like, things that you're like, oh, I'm going to forget this, like, they come back to you. The things that you've learned in nursing school, they do come back to you. So make sure you're doing a good job when you're in nursing school, because that's the foundation, I think, for later as a nurse. And I feel like my school was very hard, was probably one of the hardest nursing schools in Arizona. But because it was so hard, and I feel like they wanted a level of excellence there because of that, I feel like it set such a good foundation for me as a nurse. Because even when I'm seeing things that I'm like, that's not how it should be done, at least I know how it should be done. And I know the right way to do things, and I know like the shortcut ways. But because I have such a good foundation, I try to always do like what I was taught for the most part. And that's really important, because if you work somewhere where they take a lot of shortcuts and stuff, you still have that great foundation to fall back on and be like, that's not how it should be done. So you know how to do things correctly. That's why I feel like it's very important that you pick a good nursing school. And I did. Like, I researched a lot before I went back to school. Not only that I wanted to be a nurse, that this was something that I was committed to, because it was the second time I got a degree, so I knew I had to know what I wanted to do. I wasn't going to waste my time again or money. And I researched, like I went to several different schools and got information on them before I enrolled. And I'm happy, as hard as that school was, I'm happy that I got the education and the foundation, because I feel like that sets the rest of your career up, like how you did in school. And I'm happy that I didn't work in school, even though it's hard now getting back on my feet financially for me and my husband. At the same time, I don't regret it, because I feel like it's made the transition easier into the real world, and I feel like I know how to be a really good nurse and how things should be done. And when I'm able to do that, that's what I do. And if that means I have to stay a little later or whatever, I'm okay with that. If that means I'm taking the best care of a patient that I can. But I don't want to keep doing this forever, and I'm hoping that once I get to the hospital, I won't be having these time issue problems I'm having now. They used to have an admission nurse at my job, which made things a lot smoother, and I wish they would do that again, because it's very hard to get out on time with all these admissions, with the amount of patients we have, with the level of acuity and total care patients that most of them are, and with the amount of help we have. I think that makes a huge difference as far as how much you're able to do and what time you're getting out of the facility at. But anyways, I know I talk about nursing a lot. I hope that helps people who are interested in nursing. I definitely encourage it if it's something you are interested in, if you really enjoy helping people, if you like the medical field. I feel like I made a great choice, and continuing to like it more and more the more I do it. Other than that, guys, not a whole lot else has been going on. I just got to have lunch with a family friend who I hadn't seen in years. They just happened to be visiting the Phoenix area with their girlfriend, and they're friends with my brother. They actually used to live with us for like 6 months to a year when they were like a teenager. They actually lived with my family because they had a kind of a rocky family situation. So it's great to see them doing well and catch up and all that stuff. So, okay guys, well, I'm gonna go. I need a food shop, and I was gonna go visit my husband. He's at the Mac and Cheese Festival. Yes, they have a festival for everything here in Phoenix, I feel like. And he's actually working that event. He has a new job through AT&T now, where he hosts like the AT&T tables at a lot of like fun events and parades in Phoenix. And so that's gonna be fun. I'm gonna eat a lot of mac and cheese and carbs tonight. Yay! Okay, well, I hope you guys are doing well. Questions, comments. I talk a lot about nursing, so if you have anything, any questions about nursing or skills, please leave me comments or questions, and I'll try to answer them the best of my ability. Okay, till next time, stay tuned. Bye, guys.